Okay, we're rolling. Which foods, drugs, supplements, and lifestyle choices affect the health of our thyroid?
Well, everything affects everything when you think about it. And I think that's the big problem in medicine is the fragmentation. What food do I eat for this body part? What drug do I take for this symptom? What diet should I eat for this particular condition? But humans are totally integrated, and what affects one thing affects everything, the whole system. And so, the question we need to ask is what is the right diet? What are the right supplements, if any? And what are the right lifestyle habits that support optimal function of the whole? And then when we're dealing with a disease condition, you may get specific about a particular drug to treat a symptom that has to be treated. For example, if you're a type 1 diabetic, you don't have the option to say, I'm not going to treat it. You need synthetic insulin. Okay? So that would be a very targeted thing for a malfunction. But the rest of our time should be spent on what do we do to optimize the whole.
Do you recommend colon cancer screening tests like colonoscopies? What does the science say about the pros and cons of colonoscopies?
Well, there's a difference between using something like colonoscopy for screening versus diagnosis, all right? So if we look at the screening aspect of it, population screening, this idea that when you turn a certain age, you should have a test, this is an entirely different thing. The data for colon cancer screening is that there's not one study that shows that it reduces the risk of dying of colon cancer, population screening. The Canadians took it off the schedule of recommended screenings in 2016. And they did that because there's not one study that shows that it reduces the risk. If you look at the data, 1,250 people have to be screened in order to prevent one death from colon cancer. But in that 1,250 people, you'll have one serious injury or death as a result of the screening itself. So when you save one and kill one, that's a wash, which means no value. So there are better ways to screen if you insist on screening. I'm not for population screening for anything other than cervical cancer. I don't think we have much data showing that this other stuff works. But if you want to do something, the FIT test, which is non-invasive stool test, you can do it at home, is very, very effective, much more than colon cancer screening. There's no risk as you would have with colonoscopy.
How should people think about the FDA, the drug companies, and the medical industry?
The problem with the FDA is that the perception still exists in many people's minds that it's a regulatory agency overseeing the approval of drugs, after-market research, etc. That's not what's happening at all. In 1992, a law was passed that provided for drug companies to pay the FDA to review their products. Now, people, their jaws drop when I say this. I mean, how can this be? And so they will pay, this is 2020, the drug companies will pay this year $1.1 billion for the review of their products. Now, this won't shock you. The approval rate's 96%. And I want to see the 4% they're turning down. It must be like intravenous arsenic, right? And there probably is a conversation in the hallway. Submit this next year and we'll approve it for you. But we have to look like we're paying attention, right? So we don't have a regulatory body and an industry. We have business partners here, because there's just only so much turning down things or making life difficult for drug companies that you can do when they're essentially funding a great deal of the expense of your agency. That's not the only place where the corruption is significant. The Centers for Disease Control has a foundation. It's funded principally by drug companies, big food, big drug, mostly drug. And many of the committees of the, for example, the vaccination committee for CDC, ACIP it's called, most of those people work for vaccine companies that make vaccines. So it's a conflict of interest you can't ever reconcile. The National Institutes of Health also has a foundation, mainly funded by big food, drug companies, et cetera. And if you have time, I'll tell you a funny story about the NIH. Funny, I don't know, you have to laugh or you'd cry, right? So I think a couple of years ago, the New York Times broke the story that the NIH was collecting tens of millions of dollars from makers of alcohol, in return for which, and there were slide sets obtained that actually showed this was exactly what was being talked about. They were going to do a study showing that daily alcohol consumption was good for you and could actually be like part of the dietary guidelines for Americans or something like this. And so they got caught. They had to give the money back, and they tried to backpedal, saying everybody misunderstood. There was no misunderstanding. The promise was implicit. You give us this money. In addition to that, the National Institutes of Health receives royalties on things like the HPV vaccine. So, and again, you have this business partner relationship. So who is the regulator if the government isn't? Well, nobody's regulating. They're partners. Now, the medical profession, and there are some wonderful doctors out there. I know some of them, and I'm fortunate to know them, because if I needed a doctor, I know somebody to go to trust, right? But as a profession, doctors are complicit with all of this because they take so much money from drug companies and in the form of, not bribes or things that, well, sometimes, yes, they've been caught doing that too, but most of it's entertainment, speaking fees. You know, we're going to do a cruise, a very luxurious cruise, where we're going to educate doctors, and you can be a speaker since you're such a high prescriber. And so we'll pay you $20,000 and the free cruise for you and your family. So there are all kinds of ways that the drug companies funnel money to doctors. And as if that's not enough, one last thing I have to put in there is academic institutions. So if you look at the amount of drug company money that flows to medical centers at universities for research, it's frightening, it's disturbing. And the question I think everybody should be asking is, who's really regulating these people? And the answer is nobody. They do what they want. They're incredibly powerful. They have unlimited funds. I have a friend, by the way, who wrote a book called Deadly Medicines and Organized Crime. And in the beginning of the book, he says, interesting title, provocative. But when you think about it, the mafia, what do? They bribe the government, they steal money, and they kill people. What's going on here? It's not so different, right? And this is a guy who's a top scientist in Denmark. I mean, it's, you know, not some radical person sitting in a closet somewhere. So this is common knowledge, really, but not common enough that all Americans know about it. All Americans should, because I think it would cause such a withdrawal from the medical system that it would force change almost instantaneously.